Hello and welcome to our presentation for the 2021 Global Engagement Conference at the University of Washington, Tacoma. We are Eastern Washington University biology majors Raya Horton, Roxanne McPeck, and Yana T. We'd like to talk to you about the experience of our involvement in the development of the COVID-ADAPT simulation model. The COVID-ADAPT model is a computer simulation of airborne disease developed by our faculty mentor, Dr. Christian McGorry, who is a disease ecologist at Eastern. He developed an individual-based, stochastic, discrete space simulation model of airborne disease transmission and infection control practices. This was inspired by COVID-19, but is applicable to any airborne disease. The purpose of COVID-ADAPT is to inform policy, evaluate interventions, and generate data to better understand airborne diseases. This model is based on airborne infection and uses a susceptible, exposed, infected, recovered, or SEIR model, and also the infectious quantum idea developed by Wells and Riley as its measure of infectivity. As students working in conjunction with Dr. McGorry on this model, we help fine-tune parameters through literature searches, map buildings for use in the model, and applied psychology to increase the applicability of COVID-ADAPT. Some specific parameters we've discussed have been in the following articles, including estimations of SARS-CoV-2 quanta, the differential quanta emitted by infectious individuals doing different activities, and the risk reduction in asymptomatic infections after vaccination. Yana and Roxanne spent a lot of time mapping actual floors of an Eastern dorm for use in the model. As luck would have it, the dorm that building maintenance wanted us to start with is circular, but the model uses a 2x2 grid-based system. To get around this, we mapped onto graph paper by hand, basing room size and shape on closely approximating room square footage and maintaining connections to other rooms and hallways. The result of mapping one such floor is shown here. Acknowledging and understanding potential reasons for a person's behaviors can help us prioritize what health parameters are most influential and which to include in the model first, along with how we can better approach and encourage people to follow the guidelines. Our reading of psychological research on COVID-19 beliefs and behaviors, especially in the 3 articles cited here, found compliance behaviors do not have much variation between age groups, but students have been severely impacted in their daily lives by moving to a completely virtual classroom setting. This can lead to burnout and fatigue, making many students feel tired of following such rules and begin to deviate from them. With the theory and background explained, let's take a look at the graphical output of the model, which is a GIF of the currently simulated map, an actual dorm floor from a building on Eastern's campus. This is just a clip from a longer animation. The model also produces data files that can be statistically analyzed. The circles moving around here represent 10 individuals living on this floor. Green means the individual is uninfected and susceptible. Orange means they are exposed but not yet infectious. And red circles are infectious individuals who can infect the green circles. The red individuals also contaminate the air of the rooms they spend the most time in, represented by a gradient of red shown on the right. Green individuals who enter a contaminated room can become infected without close contact with a red circle. The circles currently move essentially based on Brownian motion, but we're hoping to implement movement rules and behaviors in the future.
This slide shows data from a typical simulation. The simulation runs for 30,000 minutes or approximately 21 days. Results for this particular simulation show 10 individuals that are on the map. 4 of those individuals start out as infectious and no one is masked or vaccinated. Results show that everyone becomes infected before the simulation is done running, and it shows that without any intervention, there could be 100% infection in the community. COVID-ADAPT has the potential for many different applications. Between variants in this pandemic and future airborne diseases, this model can help show community spread. COVID-ADAPT can also be used as an educational tool. The visual representation of the simulation is helpful for those who are not as familiar with the science. COVID-ADAPT can also simulate community spread of other diseases. Since the settings can be adapted, the model could be used for any airborne disease. COVID-Adapt can also simulate other communities, as the map can be adjusted to simulate spread not just on Eastern campuses, but also businesses, neighborhoods, or other schools. The future development for COVID-Adapt include room assignments, which allow for double rooms to be assigned, adding new floors and adding new buildings, and creating zones for diffusion so that large areas and hallways are not treated as though diffusion of viral particles affects the whole room equally, and simulating certain behaviors such as taking off a mask or where individuals go during certain times of the day. COVID-Adapt is also customizable, which allows for the adjustment of individuals within the SEIR model. Number of susceptibles are adjustable from the beginning. This allows for the inclusion of masked individuals and vaccinated individuals. The parameters that our model currently include are double rooms, masking, vaccinations, and combinations, which allow us to determine what the best method for decreasing incidence of COVID-19 is. The versatility of COVID-Adapt allows this application to simulate COVID-19 spread in different areas around the globe and simulate other diseases on a community level, such as measles, the flu, or new airborne diseases. This allows us to improve health outcomes and safety from airborne diseases in vulnerable populations. And that's the end of our presentation. Thank you for listening.